We provide information and emotional support for all our Los Angeles residents. You can call us. Our toll-free number is 844-435-7259, and that will be repeated again at the end of the presentation. You may also go to visit our website at alzheimersla.org. During this critical time, our helpline is available from 9 a.m. to 4 p.m. Usually we are in our community providing education and additional help to families who are caregiving and just the general public. However, during this time, we are still able to continue to provide services and including education in a different way. And we're all learning. So just in case there are some glitches today, please, I'm sure you'll understand. We have this new way of communication, and it's exciting as it relates to even improving our brain's health. So we can also reach a greater number of individuals than we had in the past. And today's topic is African Americans, COVID-19, and dementia. My name is Petra Niles. I'm the Senior Manager of African American Services and the Dementia Care Networks. And our speaker or presenter for today is Dr. Valencia Montgomery, who is a neuropsychologist, and she provides neuropsychological services on the inpatient rehabilitation unit at St. Joseph Memory Health Center, Ann Arbor, Michigan. She's the treasurer of the Michigan Psychological Association. She earned her doctorate in clinical psychology with an emphasis in neuropsychology from Roosevelt University and completed a competitive internship at the VA Ann Arbor healthcare system. Most recently, she completed her 2-year postdoctoral fellowship in neuropsychology at UCLA Geffen School of Medicine in Los Angeles and the Easton Center for Alzheimer's Disease Research in July 2019. Dr. Montgomery is passionate about helping others understand the course, the diagnosis, and treatment of Alzheimer's disease and other dementias. She believes that the community engagement is critical to wellness and was a sought-after speaker in the Los Angeles area and on the subject of dementia. Additionally, she has an excellent clinical and research training, having first authored peer-reviewed articles, served as principal investigator on several projects, and presented at numerous conferences domestically and abroad. She strives to provide culturally sensitive treatment to individuals impacted by poor access to services. I also want to personally thank Dr. Montgomery for agreeing to do this with us today and for being a part of our West Central, South Central Dementia Care Network when she was here in Los Angeles. Good morning, Dr. Montgomery. And
Good morning.
Good morning, and thank you for joining us. And so we're going to begin with what is COVID-19?
Yeah, so I'm so happy to be able to join you today. I think it's a wonderful opportunity to reach out across the country because I miss being in Los Angeles doing these events. So I'm so happy that I can make myself available to participate in this. Let's talk about the virus. So COVID-19 is actually a coronavirus. COVID stands for coronavirus. The 19 is for the year. So 2019 is when it was first established to be an illness or a virus. And so it's a virus that spreads from person to person. It causes this new coronavirus. So if you've not heard anything in the news about it, there are a number of different kinds of coronaviruses. And that's why this one was given the date that to add with it. Every year, I think we see new coronaviruses, just not one that has done the kind of damage or spread the way that this particular virus has spread. But it has spread throughout the world. And the symptoms can range from mild to severe. Now, one of the things we're learning is that even with mild symptoms, there can be a price to pay on the back end of that. And we'll I'll talk a little bit more about that as we go along. I wanted to share with you some numbers and why this is important, particularly in the African American community. If you're not familiar with these statistics, I wanted to share some really startling statistics with you. In Georgia, about 80% of the hospitalized COVID-19 patients were African American. 80%. African Americans only make up 32% of the entire population there. The Center for Disease Control and Prevention analysis record of nearly 1,500 hospitalizations across 14 states found that Black people made up a third of the hospitalizations. 1/3, 33%. You think about that in the context of the fact that we only account for 18% of the population in the areas that they study. The Associated Press analysis of available death data found that Black people constituted 42% of the victims, doubling their share of the population of the states the analysis included. And then you have Louisiana, where 70% of the people who died from COVID-19 were African American, twice their 32% share of the state's population, and well above the 60% share of the population of New Orleans, which is where the outbreak was the worst. New York, we comprised about 9% of the state's population, but 17% of the deaths. And although we make up about 14% of the population here in Michigan, we account for 40% of the state's 1,076 coronavirus deaths as of the 9th of April. That number has increased. In Chicago, my hometown, 67% of those deaths have been in the Black community. So that's very startling. Those are stark numbers to hear. And there are a number of reasons why we're at risk for this particular virus. As African Americans, we have more underlying health conditions that are associated with fatality. Heart disease, diabetes, asthma, and obesity. So we're 50% more likely to have heart disease than white people. We're 40% more likely to die at an early age from any cause. And we're 19% of us can't afford to see a doctor. There's also the question of disinformation. I don't know about any of you, but early on when this pandemic first started getting legs in the United States, I got a lot of messages from people saying things like African Americans don't get the coronavirus, or, you know, use these techniques and it'll get rid of the coronavirus. Anything from taking garlic and lemon and honey and mixing it together to drinking it, to just a variety of things. So there was a lot of disinformation out there. And another reason why we're at risk, which you probably haven't heard about in the news yet and may or may not hear about, will be our fear of inoculation. So if you again are like me, you've probably seen some of the posts in social media saying that they want us to be their guinea pigs, or, you know, I'm not going to get a vaccination because of any number of reasons. They're trying to control us. It's going to be used to control our minds. So there is a lot of disinformation out there. There are also those people that believed it was a hoax. They didn't believe it existed. Okay. So when you take all those things and you put it into the context of where African Americans are generally located. So you think about New Orleans, it's the major city. When you think about Detroit, it's the major city here in Michigan. When you think about Los Angeles, right? You think about the areas that we populate, they're more densely populated, which means early on when we probably could have maybe saved some more lives by telling people to stay at home and practice social distancing, it's very difficult. You think about New York and how densely populated New York is. And just by benefit of the fact that we tend to reside in those areas that are densely populated, make us more at risk, coupled with all of these other factors, right? We're more likely, a lot of them are likely, a lot of us are likely to hold jobs that require us to continue to work with the public, putting us more at risk for exposure to the virus. Okay. Um, there are just so many different ways to look at how we're at risk. Those are just the major ways that we've been at risk and why we see the numbers. You know, we're not, we're including the health disparities, right? When you think about African Americans and where we live and the health disparities in the system, so many times here we've heard people's story of going to get tested and being turned away from testing several times, and then turning up at the ER, shortness of breath, and dying shortly after. So access to the testing was also a reason why we're more at risk to die from this particular illness. Um, where we're located, what kind of medical structures, what kind of services are available nearby. Are many of us maybe in community healthcare systems that aren't equipped to deal with something like this pandemic? And so we're at the mercy of people doing the best that they can in our communities at times. And so that's also a factor that's affecting us. So again, there are so many ways, and a lot of it is rooted in the idea of when this virus first became known to be a pandemic, the CDC was not putting out race of individuals. Okay. One of the things early on that I was speaking out against was the fact that we didn't know what the makeup was. When I started seeing those notes from people saying African Americans don't get this virus, I became concerned about the fact that we're not hearing numbers by race. We're only hearing numbers. And sure enough, as soon as the CDC was pressured to release that data, we now learn that much of what we were hearing about in deaths were attributed to African Americans or people of color. And so I attribute some of that disinformation to the fact that people weren't hearing. You know, in our community, a lot of times, anytime anything strikes us, you hear that, you know, African American whatever happened. You know, you hear our race pronounced quite openly, but for some reason with this pandemic, race was not disclosed early on. And so I believe that that may have been also part of some of the rumors and disinformation that was placed out there. So thinking about our mental health, you know, people's mental health across the board have been impacted by COVID-19, from having to be the stay-at-home orders in states across the country to the stress associated with having to go to work, healthcare workers, first responders, grocery store workers, restaurant workers, being out of work, worried about when you're going to come home. Something that I like to call the suspension of future orientation. And what I mean by that is when you think about how life was before the pandemic, and I know that that's how for a long time we're going to define our lives. When you think about how your life was before this pandemic, think about how you used to make plans. Plans so simple as, I am going to the beach this weekend. Oh, I'm meeting up with friends and we're going to hang out. We're celebrating a party. Oh, someone died. We have a funeral or memorial service for them. You know, we can no longer plan those things because we have no idea when life as we know it will return to the way we knew it before the pandemic was such a large part of our functioning. And so that alone begins to wear on people, that inability to make plans and think about future things, because we don't know financially where we'll be. We don't know, you know, people are worried about rent. People are worried about buying food. I mean, now we're worried about the food supply. So it seems like constantly there's a barrage of more concerns rather than good news, another bad news thing that we have to be concerned about daily. And that plays heavily on the minds of African Americans. If you think about, the food deserts, many of the times when we saw advertisements where stores were gouging for prices for day-to-day things that people needed, like sanitizer and toilet paper, it was in Black communities. Um, so, so there was a lot of concern in that area. So we are more subject to things like anxiety and depression. There's something called acute stress response where, you know, you think about people that are working every day, going out the door and going into the store and dealing with people who, to be quite honest, were very nasty to a lot of people when this first started. So they have to deal with the public who aren't always considerate. Um, and faced with that can freeze up and become overwhelmed and not be able to function, not be able to make decisions in the moment, not be able to make good decisions. So acute stress response is a response that happens in the moment after maybe days or weeks, or in this case, months of being under that kind of strain, where one day a person just is unable to deal with it. We will also have to be concerned with PTSD after the fact, okay? So a lot of people, this is very stress inducing. It's quite common that after events and tragedies like this, national emergencies and such, that people may suffer from PTSD. A lot of us are not able to say goodbye to our loved ones who are dying. Some of us are having to do that on the phone, um, on FaceTime or some other way. Many people aren't able to say goodbye in the traditional way that we do. We don't know how to mourn in this situation, because the way most of us may mourn is to go to the funeral and to see family members and to be able to reach out and touch, if we want to, that loved one, and say our goodbyes and get closure. It almost seems like it's suspended right now. We, in our minds, know that our loved one has died, but again, it's not the same as when we are allowed to the benefit of being able to say goodbye. So the other thing with this is, because so many of us are dying, sometimes because we're getting turned away from testing, that also takes a toll. If we're seeing our family members one after another turned away from testing and then dying of this, we feel helpless. When we see our family members in institutions that are not set up to do any of the life-saving investigational trials to conquer COVID, and we can't get help, it is exhausting. And so, therefore, we have to monitor our emotions and take a temperature, I say, of our emotions and see where we are and reach out um, when we feel overwhelmed by these events. The other problem with the emotional effects of COVID in our community is that individuals who have not been to the doctor in years and may have high blood pressure and don't know it, it can push them into a state of illness, depression, and anxiety. Stress responses will impact you. You'll see more people having strokes, or these heart attacks and things like that. And right now, the last thing you want to do is have a heart attack and have to go to one of these major hospitals where you're in the hallway with other people with COVID. And so there are a lot of emotional effects that have underlying health consequences that we should be aware of. And in checking in on each other, we need to listen, because we're not going to necessarily reach out and say, hey, I'm having anxiety today, or hey, I'm having depression. I haven't gotten up and washed my clothes or taken a shower in days, right? And so because many people are forced to stay home, they start to fall out of the routine of getting up every morning and showering and going about their day. And so, I'm recommending to people that they at least monitor that. It should not be a week that you go without showering if it's something you used to do every day. Uh, and that you get to do it, because it's amazing how much better you feel when you add some normalcy back into your lives. The other thing is that people create a schedule. So many people are grumpy from having to stay at home, and they're tired of binging TV. And I suggest people don't binge TV. I suggest that people do a schedule where they're actively using their brain during the day. Brain function is important, and where they're making connections with others, because a lot of people have screen exhaustion and they don't understand why they're so tired when they're not working or doing their normal activities, but it's something that they're calling screen exhaustion. And so people working from home tend to have it more because they're in front of the teleprompter or the computer a lot more. And so it's just to be aware of all of those things and their effect on our community. I think we're going to be a long time getting therapy, and hopefully, we're not a culture that really reaches out to psychology, but I'm hoping that people will find themselves reaching for help outside of the family, because we're all going to need it, even those of us that provide it. Okay. So one of the bigger issues that early on I had conversations with other doctoral uh, providers here about was dementia, and how does that affect families? Um, a number of ways. People that are caregivers for a family member with dementia have even more of a burden because they're worried about going out and bringing something back home, or getting sick and not having anyone to take care of their loved one. Um, there are a lot of concerns about individuals being at home for so many hours with a person with more advanced dementia who becomes irritated or agitated during the course of the day, and people starting to lose patience because they don't get a break ever. And so really encouraging those people to reach out for support, and for tools to help them cope during those times. The other thing is that, given how many risk factors we have that make us more susceptible to die from COVID-19, those same things make us more likely to develop uh, a type of dementia or cognitive impairment. When a person has COVID-19 and they're struggling to breathe, it increases their blood pressure. It decreases the amount of oxygen that is taken in until they're hooked up to an oxygen tank, which means that it can cause something called a hypoxic or an anoxic injury. The other thing is, if blood pressure is high, it puts you more at risk for a stroke. COVID-19 itself has been known to cause strokes to develop in the body, so that puts us at risk. And so there are a number of risk factors. Having asthma, it increases your chance of having difficulty breathing. So all of these risk factors that we have just as part of our everyday lives make us particularly susceptible to developing a dementia, or maybe someone who is in their 60s or 70s who might have some little glitches right now where it's not really noticeably a dementia process. Having this illness can push you over into it, and that will range. But we saw that before COVID was a thing. We saw that when people would have a surgery and they would come out, and then they would just seem like their memory was impaired. They had impairments cognitively across the board because of the surgical procedure. We see it when people get very ill, and we assume that there was an underlying process, but Alzheimer's is a very slow downhill thing, but it can turn into a very steep illness when compounded by something like the COVID-19 virus. I wanted to share some of the things also that maybe you haven't, or maybe you have heard about, that's been happening around the world. There's been a small subset of patients with COVID-19 that are developing these serious impairments of their brain. Now, some of them have altered mental status. Others have something called, encephalopathy does cause an altered mental status. It can have a lot of underlying causes, as well as other serious conditions. And some of them are unusual symptoms, like a diminished sense of smell and taste, as well as problems with their heart. So one of the things that we are hearing is that individuals like in their 30s and 40s are having these massive strokes. And these are people that had what we're calling mild symptoms. And they're finding out it's because of the blood clots. So people aren't thinking that they have COVID, the virus in their body, and that it's going to cause major damage when their symptoms are mild. Some people have been asymptomatic and have a stroke. So uh, it's particularly important that we understand this, because when we go to our doctors or when we test positive, we know to contact our primary care physicians and ask for a physical. Tell them I was COVID positive, I had mild symptoms. I understand that there are some certain things that can happen to your body, like problems with clotting and etc. And I just want to make sure, given my history, that I'm okay, and let the doctors handle it. Because I think if we're not proactive, we'll wind up, we'll end up in the end seeing a lot more people have these problems later on in life, or have small strokes and not know about it, when there are medications you can take to make sure that your blood is not clotting and that you're not concerned with a clot going to your brain or your heart or some other area. If you know anything about the young man there, who's a Broadway star who's in a coma there in LA, the disease caused him to have clots in his leg, and they had to amputate his leg. He's not awakened yet from the coma he's in. He's been intubated for over 20 days, and I think he most recently just had another clot to his brain. And so this disease can cause you to throw off clots in your body, and these are healthy people with no underlying conditions. So I think it behooves us as a community to educate ourselves about all the ways that COVID can affect the body, and not just the obvious ways of the people that are having the severe cases. And so you're seeing this snowball effect versus those that have mild cases. People get it. Oh, I'm positive. Oh, I never had any symptoms. Or, oh, I'm positive, I had a mild cough or whatever. And they think I'm clear now. And that's not necessarily what that means. And so I think it behooves us to advocate for ourselves if we find ourselves or family members in that condition, and reach out to your primary care physician and find out what next steps should occur. Okay. Some doctors in the Detroit area also have a case that was a female worker who was in her late 50s with COVID, and she was confused and complained of headaches. And she could tell her physicians her name, but she couldn't tell them anything else. And ultimately, what they found out was that she had something called necrotizing encephalopathy, which is a rare complication of influenza and other viral infections. So again, this is a novel virus, a new virus. We haven't even, in my opinion, touched on how much it does damage in the body. And we continue to learn, and we expand our understanding as we learn more. You can see from them starting with just having a cough and a fever, and I think it started with cough and a fever, and then they added sore throat. They've now added some of the other things like diarrhea and loss of taste and smell, and these other things. And one of the things I was curious about earlier on, and my question has yet to be answered, was whether African Americans were presenting differently, meaning they had other of these symptoms that they're now expanded upon at the CDC. Maybe they presented more of those symptoms, and so they were turned away. And that makes a difference, right? Because in certain illnesses, African Americans do not present the same as other cultures. And that means that it can also be a chance that we're not presenting symptom-wise the same. And so we're not getting treatment because they have this limited list of things that you have to meet the criteria for, when maybe in us, our criteria should have been, loss of taste and smell, or diarrhea, or one of the other things. And so just really understanding how all of these things play together, I think, equips us to better understand how to advocate for ourselves, because that is going to be the most important thing, and how to advocate for our loved ones. I feel like I went through that really quickly.
There's an opportunity for questions. For those of you who are connected by internet, there's a chat section where you can simply send your questions, and Dr. Montgomery will be happy to answer them. But in the meantime, while you're sending your questions, Dr. Montgomery, can you speak to what our CDC is saying, as well as our local community public health departments, as it relates to social distancing and wearing face coverings, and those recommendations that they've given us, testing and sanitizing, washing of hands? How carefully must we follow those?
So if you were my family, and I believe you guys all are, I would say follow everything as much as possible. Here's why. We still do not know enough about this virus. I predicted amongst my peers early on that this virus will have something that is called a unimodal distribution. No, I'm sorry, a bimodal distribution. And that's when you have two humps in a chart, right? So you have this hump that we just are hopefully on the decline on, but then you have a period where it looks like everything is good, but then it starts to go back up again and you have another hump. And that is going to be because we didn't have a chance to put in place many of the protective things to keep us safe. So without the benefit of a vaccination, and let me talk about that a little bit too in a minute, but without the benefit of having a vaccination, without the benefit of really knowing whether people who have COVID are immune to having it again, then we need to protect ourselves the best we can. So covering your mouth for sure when you're out, because it's not so much that you're protecting others, it's protecting yourself, but you're protecting others in case you're a carrier that's asymptomatic. Okay, if you can get tested, I think testing is great, but once you leave the testing site, who's to say you don't get exposed to COVID? That's my bad thinking though. But testing is good because at least you knew you were negative. It's just like with anything, right? You know you're negative for an STD when you take the test, but if you go out and do activities that put you in jeopardy of contracting another STD, that test is no longer valid. Does that make sense? No feedback. Okay. And so I think that we need to do all those protections in order to protect others and ourselves. So the more people that wear masks means there's more barriers between two people, okay? And if we have those barriers, then that means I'm protecting you and you're protecting me. So, it increases the benefit of wearing the mask. Does that make sense? I don't know. I should stop asking. Does that make sense? I hope that makes sense. The other thing is the distancing, the social distancing. So, I mean, I think it's important still because we're still seeing cases, like hundreds of people are still dying every day and people are still becoming symptomatic. So I think that social distancing was what got us to the number we're at and limited the amount of death that we've seen and the amount of cases we've seen. I think that rushing back out, trying to have the normal American lifestyle is just a fantasy that people can't let go of. And I think it can be to our detriment in the end, especially if we continue to just jump back into life without answers as to how to prevent this disease from spreading. As far as inoculations are concerned, they're working on a vaccine against this. One of the things I've heard from people is they're going to use as guinea pigs. You start to have a lot of emotional context surrounding receiving a vaccination. Even though we receive them all the time for mumps, measles, rubella, those have been around for a long time. The problem with not taking part in any research around this disease, if you're healthy, is that if we don't participate, then the only sample that they're going to base this vaccine ability to work on is on the people or the group that participates, which is normally our European American citizens. That means that should we get the vaccination, it may or may not work for us because we're getting some medication or vaccination that is based on how the virus worked in that community. So that may be okay, it may not be okay. But it's always a problem when African Americans don't participate in any of these research findings. And that's why a lot of medications, the doctors are always tweaking, or they find out they don't work for you, or they're not as effective as in whites because we didn't participate in any of the research involved in that. So bear that in mind. Without a vaccine and without understanding a good treatment for it, even though they think that they've identified a workable treatment, we're in for the long haul. And even if they find a treatment, it's not to say that we can survive it if we still get it. So washing hands, we should have been doing that prior to this, but even more, it's important to be aware of what you're doing with your hands. I touch my face all the time. It's a problem. So this has been really hard for me because I'm constantly reminding myself not to touch my glasses, not to touch my face when I'm at the hospital. I'm constantly sanitizing. I wear a mask when I go out to walk my dogs because I see so many people out running and walking with their kids with no masks on, because I don't think people understand that the virus can stay in the air. Although it's not airborne, if somebody coughs and they have the virus, it can linger in the air for a couple of hours. That means that if somebody's jogging and they cough, and they may not really be showing symptoms, and they might think the cough is just from the exertion, if I walk through where they were in the next hour or two, those particles, and I have no mask on, those particles are more likely to get into, I'm more likely to get sick. Okay. And so I think people don't understand how that works.
Thank you for sharing those. We do have some questions, which I will read. Regarding resources, there was a comment regarding resources, and along with everything else, resources are coming out daily. And now, yesterday, our mayor of Los Angeles has said that there will be free testing for everyone. The details of that is not available as yet. However, today I'm sure more information will come out. This morning, Charles Drew University has shared that they will have testing available. I do have that information and will share it with those of you who've been invited. Any information that I have, I will share with you. One of the questions is also,
can I just cut in and say something
yes,
about that too? So
yes.
if you have a loved one or someone that you know has the virus and are not doing well, there's a couple of things you need to know. Find out if the hospital that they're at is doing any of the trials, the investigative trials with the remdesivir, which is the investigational drug, or the convalescent plasma. If they don't do it and the person is a child under the age of 18 or pregnant, you can contact Gilead Science, who are the manufacturers of the drug, and they have a compassionate use exemption that you can possibly get the hospital to use that drug or get access to the drug through the Gilead. And there is something called I think it's COVID USA Plasma, where if your person is at a hospital where they're not using the convalescent plasma and they meet criteria, there's like questions that I guess you go through with the doctor, and if they meet criteria, the bank closest to where you are will drop the plasma off, and I guess they give the doctor instructions on how to administer it. So there's convalescent plasma that is being the expanded use of that is how you get it, but you have to go through the site and get all the information. And Peter, I can send you that.
Yes, please do.
Full disclosure, I know all of this because my uncle has been intubated for over 20 days in a hospital in Chicago in the African American neighborhood where they only have a community hospital, and he's coded a couple of times. He's pretty severe. And I have been exhaustively searching for a way to get him access to some of these trials. And in my efforts, I have collected this information that I'm sharing with you now.
We appreciate that, and I will share that with everyone. Here's another question. Is the government allocating additional funding to study African Americans with Alzheimer's and COVID-19?
So that's a good question. I am part of the founding of an organization called the Society for Black Neuropsychology. We just finalized the letter that we are sending to the COVID-19 team, which includes Vice President Pence and Dr. Fauci and all the heads of the task force, where we are making recommendations that funding is specifically allocated for the study of the disorder in African American communities, and that includes the people that with mild cases who may throw clots, etc. And so at this point, I'm not really sure if there's just COVID funding available, but we are advocating that COVID funding be put aside, especially and identified for the African American population. Along with that, we recommend that they only fund researchers who have outlined a path for recruitment of African Americans into their studies, meaning that they can't just say, we tried to recruit and nobody wanted to recruit. So their recruitment efforts may have been putting up billboards or putting signs up in places that people are not going to look for it, rather than coming out into the community or reaching out in the community to build relationship, which is how most of us will participate in research. So they have to actually submit a plan for recruitment of African Americans before they're awarded those dollars, to make sure that we're not excluded because of poor effort. And so while I'm not sure yet whether they have completely identified funding, our letter will be going out this week, and I can send Peter a copy of that as well.
Thank you for that. Here's another question. Well, first, a resource. Thank you, Joseph Herrera, for sharing that. The website for Los Angeles Public Health is www.publichealth.lacounty.gov. And this is a resource which sends out information on a daily basis regarding up-to-date efforts on COVID-19, where to go from food to testing. Thank you.
And if I were to be perfectly honest, one of the best ways to go about trying to test everybody and make sure everybody gets tested is to go out into these communities and not make the communities have to come find where testing is. I mean, they certainly come out for census, don't they?
Yes. Here's another comment, a question and comment. Thank you for an amazing discussion. How can we support our communities of color right now?
Yeah, so I would say, it depends on, I say do what you can where you are. So does John Bon Jovi, by the way. If you can't do what you do what you can. And it can be simply as donating money to some of the local organizations that are helping to feed people. You can even reach out, in your immediate community to find out if people need help. Older adults are one of the most hardest hit, because sometimes they can't get out and they don't, they can't afford the delivery fees. But there are ways you can do that if they're taking volunteers to man some of the tracing. I don't know how LA is going to do their tracing, because I think that's one of the things that has to be in place, contact tracing. But if you can financially afford to, if you can volunteer at some of the food places, if you can volunteer to deliver things to people, obviously with your protective gear on, I think those are all ways. If you know of communities like this, where there's a forum where we can get people on, so that the more education, the more people are educated, the better prepared and equipped we are. So there's a number of ways that you can help.
Thank you for that. Another question is, what is your thinking on social distancing within congregate care settings, including group homes with youth?
Oh man, that is so hard because these groups, these group homes and kids and stuff, they've had it really bad, right? Because they're not getting the outlet or the support the same way that they have in the past. I think that just like in the hospital setting, we're standing next to each other. I go into patients' rooms. Sometimes I have to take my mask down to be able to assess them properly. Um, there is some limited risk in those things, even with protective equipment on, personal protective equipment. I think it's going to be important to re-engage safely. And so I think that if you're in a group home environment and all of the individuals have been tested and they test negative and no one has symptoms, that's going to be the process of it, so that you can start getting the groups, that you keep the social distancing as much as you can within a room. So we still have our team meetings, but we have the chairs staggered around we use a larger conference room, and we stagger the chairs, and we make sure only the personnel that needs to be in the meeting is in the meeting at any given time. And so that's how we're practicing it to the best that we can, but it won't be perfect. And so I would say that as soon as we can regain those kinds of, support services, it's going to be important, but also using venues like what we have here, the Microsoft platform or Zoom, where you can do check-ins, face-to-face check-ins with people as a group. You can do groups on there as well. That might have to be the case for the groups that can be managed that way.
Thank you. One of the comments was also, thank you, Aziza, for sharing that Drew has been testing for 3 weeks now, and it's a drive-through process with or without an appointment, and you can just drive up and be tested that way. And we appreciate the work that they're doing. Here's another question. The slides, the availability of the slides, we will prepare the slides as well as to include the resource information and share that with all of you who are here today at some point. So tomorrow's Friday, give us by Monday. We thank you for that. Any other questions? One of the things that I want to ask is the blood clots. Can you share a little bit more about what would be some symptoms for even blood clots?
So that's a good question, because I'm not a medical doctor.
Yeah.
I can only tell you what I understand from the literature.
Yeah.
And that is, okay, so we know that the embolisms, the pulmonary embolisms, are basically a clot to your lung, and that comes with pain and sometimes pain and difficulty breathing. And so that is an emergent situation. You should be immediately at the hospital for something like that. Don't think it might get better, it might pass. Go to the hospital. But the other thing is, severe COVID symptoms involve the same types of symptoms, right? Pains in a leg, swelling in an area. In fact, one of the news stations had all of the things you should look for to identify whether you're having clots. Yeah. I don't know if at some point they're going to decide that enough people who had mild cases are significant enough to prophylactically put them on a blood thinner for a short spurt. It's something that they do with people that have had strokes or other brain injuries. Sometimes they put them prophylactically on a seizure medication to prevent a seizure rather than to treat the seizure. So to try to prevent any seizures from happening. I wonder, and this is just me out loud thinking, if whether at some point they will the CDC will come up with a way to think through when people who have had a mild case and could be, clotting, might be getting it prophylactically. And so, yeah, right now, all you can do is monitor for things like swelling, because a blood clot blood clot will be stopping blood from getting to a specific area, and that will likely cause pain and swelling. And to make sure that you don't ignore it and that you go to the hospital and seek emergency care right away. And I'm going to look and see if I can find that list, that full list, and I will send that to Petra as well to go on this this information that she'll be sending out to you.
Thank you. The diagnosing of this disease, COVID-19, requires the nasal testing and the antibody test. Can you speak to those two tests?
Not really. What we know about the testing is that it's not perfect, whether you have the nasal or whether you do the antibody test is not a test to see whether you're positive or not. All the antibody test does is tells you whether you had COVID or not. And that's with anything. So when you get a shot like mumps or rubella or whatever, and you go work in the hospital, they make you bring in titers, something called titers. And that is, they draw your blood and they look for those antibodies in your blood. And that tells you that you have immunity to it. Because we don't know whether you can develop immunity to the coronavirus or not, finding out those antibodies, they're trying to figure out whether they stay in your body, meaning, is it just there for like 3 months and then you don't find them anymore, or does it last permanently, which is more likely to suggest that you can develop immunity to it. So you'll hear things like herd immunity and all that, but herd immunity only works if in fact you can develop the immunity. Okay, so that's what the antibody tests are for. They're not to say whether you're positive or negative. Now they have several different types of tests. Now they have a rapid test that's a stick where they can tell you in 5 to 10 minutes whether you're positive or negative. They also have the different swab tests. They have a rapid swab test that they can tell you in a couple of hours whether you're negative or positive. And then they have the regular swab test that should be coming back in 24 hours or whatever that can tell you whether you're negative or positive. At our hospital site, and I don't know if this was just for employees or not, but I was exposed, and so I had some symptoms and I had to be swabbed. And the rapid test came back in a couple of hours and it was negative, and then I had to wait another 24 to 48 hours and I got the other test and it was also negative. The problem with that is some people have had the virus and gotten negative results, and some people haven't had the virus and had positive results. And that is the sensitivity and specificity problem, because none of these tests have really, maybe one or two have been approved by the FDA. And it's just a bunch of different of these pharmaceutical companies or other companies that are coming up with a way to test for COVID without having FDA approval, because they're rushing it to market so that we could start testing people. When we had an opportunity to use the test that the WHO had developed, we didn't want their test for whatever reasons and decided that we were going to make our own test. And now we have a bunch of different ways that the virus is measured to see whether it's positive or not. And none that I know of are fail-proof.
Okay, thank you for sharing that. One of the questions here is, what is the long-term, or do you have a sense of a long-term impact of COVID-19 on diabetes?
Wow, that's a good question. Okay, so diabetes is unstable in all its ways. And it's unfortunate because I'm going to say that we don't know. Quite frankly, we do not know. But what I can tell you from the knowledge that I have of diabetes and how any kind of illness impacts it is, the better it can be controlled, no matter what, the better it will be. COVID is going to have an impact because it sends your whole system into craziness. And you just have to monitor it carefully and make sure that your doctor is also monitoring it to make adjustments in medication as needed. This is not the time to be experimenting with cutting half a pill or taking partial dosage of anything. You want to closely adhere to your regimen, closely adhere to the food restrictions, and try to manage this as closely as possible without continuing to run high or run low. Because if people get COVID, it's likely to impact how your body responds to the medication. It's likely to impact how well you get better from it. And so, medical professionals, the doctors that, especially the doctors that specialize in diabetes management and this virus, are going to be the ones that can get a better idea. But again, remember, this is a new virus, and seems like every day we're learning new stuff about how it's impacting our bodies and how it's impacting those underlying illnesses. But certainly, if you think about the mortality rate of people with those risk factors is high, you can better understand that it definitely has an impact on how well people come out of COVID.
Thank you for that. You mentioned earlier when you were speaking about the emotional impact on African Americans, some coping skills. It's necessary to have coping skills. Can you list or discuss a few of those that we should have?
Yeah. So mindfulness is the one that I go to a lot. When you think about anxiety, anxiety is fear of something happening in the future. It's not anything that's present. And when you think about depression, it's a lot of rumination on things that have already occurred. And so one of the things that I do at my job when I go in with my fellow colleagues is I bake cookies. I wrap them in individually packaged things so everybody doesn't touch the cookies. And I put mindful tips on them. And it can be simply as when you find yourself with your mind running and racing about what's going to happen next, that you just stop and take 3 deep breaths. You just take it in and exhale it out, and you pull your mind back to right now, what you can do, because again, you can't plan for the future really because we don't know what that looks like yet. So practicing meditation, distracting yourself from those thoughts by doing something, find a hobby, learn something new. There's a bunch of places offering free classes online. I always suggest people use education because it's good for our brains, right? And so, you can do guided imagery meditation. There's a lot of online. If you go look up meditation scripts, sometimes they're on YouTube. They have meditations. I use an app on my iPhone called Breathe to Relax. And it helps me when I can't get to sleep. I use one of the sleep ones. It teaches you how to meditate. It has you log your mood daily. That way you can see if you're starting to be depressed or anxious. And it can guide you through meditations according to what you've reported as your mood. Take a walk if you can. Go outside if you can at least just step outside and get some fresh air. I know the people that live in high rises probably have it worse because they're piled up in there and they don't usually have balconies. But if you can get down and just take a walk around the block at a time when everybody's not trying to take the same walk, it might be helpful. So those are just a few ways that you can use some of those techniques to help you cope. Yeah.
Thank you for sharing those. There's also this question, what is the best advice we can give anyone if they should say to us they have some symptoms?
Go get tested.
Yeah.
Go get tested. And in LA, that shouldn't be as big a problem now because everybody's getting tested, right? So if you have any symptoms at all, I mean, my symptoms were so mild. You still can't tell me that I didn't have it, but my symptoms were so mild, and I called and I was like, I would ignore this, but this is a change for me. So when you know it's a change for you, You can call and you can advocate for yourself. I did not have a temperature above 100. My temperature was in the 99s, but my baseline temperature, because we've had to take ours twice a day, every day for over a month, my baseline temperature has always been less than 97.5. That means that 2-degree change is a difference for me, right? And when it persisted for more than a day, I called right away. I knew I had this cough. I also know it's allergy season. I also know that some of my joint pain could be an underlying medical condition, but I'm not going to diagnose myself. I am not a medical doctor, and even if I were, I wouldn't diagnose myself because we can get it wrong, and oftentimes we do. So call and get tested. And if they won't test you, which they should in LA, but if you're in another place and they won't test you, advocate for yourself however you can.
Thank you for sharing that. Are there any more questions? We certainly appreciate all of you who have joined us today. And just one more thing from Aziza, who has shared that Drew has tested approximately, 3,000 people, and that's really great. Aziza, if you could send, if Drew has a website or an update of what they're doing, we could also include that in our information to be sent out. Thank you so much. Let me just check. I think there's you mentioned, Dr. Montgomery, you mentioned stories about African Americans going to get tested and being turned away, then dying. Where was that happening?
It's happened a lot in Detroit.
Detroit?
Yeah, right here. I'm on a Facebook group where they're putting up memorials all the time. There was a nurse, no, she was a phlebotomist here at one of the local hospitals. She got sick. She went to her own hospital and they told her that her symptoms were too mild and they sent her home. She went to 3 other hospitals and was turned away. She's African American. And by the time her symptoms had worsened, she went to the county hospital and they admitted her and intubated her, and she died shortly after. And that's unfortunately something we hear about so much, and it's heartbreaking. It is simply heartbreaking.
It is.
And personally, I'm going to tell you, I have all the symptoms. If I feel like you're going to turn me away, I'm not going to go in there and say, oh, it's mild. No, I'm coughing up a lung. Are you kidding me? No, I'm just exaggerating. But seriously, I couldn't get turned away from 4 hospitals. My niece, though, perfect example. My niece had all the classic symptoms early on, and she works in healthcare. And I think anybody that works in healthcare and has kept working should automatically get a pass and get themselves tested. But my niece, who is an EEG tech, and so she's really has to be close to patients when she's hooking them up to the machine and everything, had all the classic symptoms, and she got turned away. And this was very early on, but they would not test her. And so now her test came back negative a couple of weeks afterward, but her doctor is trying to advocate for her to get the antibody test because her doctor believed that she did have it, but that she cleared the virus when they finally tested her. So her test came back negative. That's how long it took her to get tested.
Yeah, thank you for sharing that, because here's a question that's kind of on that vein. Should people be concerned about going to the doctor for routine care because there's also the fear of the virus, and it certainly is a plug for telehealth.
Yeah, I mean, if there's, you know what, before the virus came around, I used to be angry that I had to go to the doctor so she can look at me and then send me to get an x-ray, or prescribe something that I've already had. So I really am an advocate for not going to the doctor's office, even when we didn't have a pandemic, if you don't have to. I am quick to grab the nurse number on the back of my insurance card to call the nurse and tell them my symptoms, and then have them tell me to go to the hospital or go to the doctor or whatever. But I always consult some way, if I can, virtually before making that doctor's appointment. Now, for those of us that have underlying chronic illnesses, it's very important that we do not miss those appointments because we're afraid to go in the doctor's office. In those cases, most doctor's offices that I've been in, they're prepared to make sure that you're safe because they don't want to get it. Okay. So when you go in, you will go in with your mask, you will go in with your hand sanitizer. They'll have enough of it there for you. If you don't have a mask, they'll offer you a mask. I say take it. They try to keep people from sitting next to each other in the waiting rooms. And then the doctor will see you. I don't think your risk is any more high. In fact, I think your risk is probably a little lower because most people that have COVID aren't coming to their doctor's office because they've been told, don't come in here if you have COVID. So you're probably safer than if you're going to the grocery store where people are coughing and they have a fever, but they're just not saying anything because it's only them and nobody else can come out. They don't have anybody to do anything for them. And so they're in a position where it's like, either I go to the store or I don't eat, and how can you blame them? So, yeah. So I would say, especially if you have an underlying condition or an emergency, do not stay at home because you're worried about COVID. You want to make those appointments. And if the doctor can't do a telehealth appointment, you want to make sure that you stay on top of that because your health is still the primary concern. And underlying conditions can quickly become out of control because of fear. Okay, so we don't want that.
Thank you so much. I believe that's it for questions. We did schedule this for 11:30. However, that was based on the number of questions. We wanted to make sure that we had time for that. So if there are no more questions, we definitely want to say a special thank you to you, Dr. Valencia Montgomery, for joining us today, and to thank you, all of you who are today's audience. And we certainly appreciate Alzheimer's Los Angeles, who has moved quickly with the times and is able to bring this a very important presentation to all of you. As I said earlier, our helpline is available from 9 a.m. to 4 p.m., where many languages are spoken. We have qualified care consultants, care counselors, who will be able to answer your questions and give you resources as are needed. Support groups are available by telephone. We have these virtual support groups are new, and we are here for you. We appreciate all of you. Again, if you have additional questions, you may call our helpline and ask for me, Petra, and I'll be happy to get back with you with the information that you're requesting. Again, thank you, all of you, for your time, and please take care. Here is our information if you need to write it. Alzheimer's Los Angeles. You can connect with us on Facebook or whatever social media platform that you have. Thank you again, and please take care.
Bye.
Bye.